Namaste. Welcome back again to the session, and mm, today the focus is on HIV, as we all had been listening in the last couple of episodes, and along with that, let us converge it with the ongoing pandemic in the world, and that is the coronavirus. I'll give you a live example. What happened a couple of weeks back? I received a call from a client who was pretty desperate to understand that why he's infected with HIV. Though he informed me about that there was some exposure he had, which he was not clear, and he wasn't even telling me properly. And then he informed me that doctor, I had been getting myself tested, and again and again the report is coming positive. I've got myself tested in the last 1 year, maybe every month he's getting himself tested, and the result is HIV reactive. And when I kept on hearing this, and when I was trying to counsel him and make him understand that there is no need of testing again and again, and when it is very much confirmed that he is HIV positive, he was in a denial mode. He was not at all agreeing or was in a mood to listen what I was trying to make him understand. And then it was like at the end of the call he literally asked me that shall I get myself tested, and I was like, I have told you, and it's your wish. If you still want to get yourself tested, you're most welcome. But you have to understand that when you know that you are positive, you have to get yourself on antiretroviral treatment, which he had not yet started. So later, when I disconnected the call, and when I was thinking, I felt the situation is pretty similar to what is happening today, which is the coronavirus pandemic. People, in spite of having symptoms, they go ahead with self-medication. They go ahead with even not even understanding that they might be infected, or maybe they just don't want to accept that they're infected. And then when I was thinking later about why this is happening, and it just had struck my mind that it is all because of the stigma and the discrimination which is all surrounding it, whether it is HIV or whether it is the current COVID. Because if you get infected with COVID, what exactly is happening? If your neighbors come to know, you have a self kind of realization that most likely I'm going to get outcasted. My house will be like completely boycotted by the neighbors or by the society around me, which is not right. And I think it started, or it was then in the beginning when the pandemic started. At least it was visible in India, where people were literally keeping themselves aside, and the reason was they don't wanted themselves to get exposed with the infected individual who's living in the house, which had impacted, because we already have completed a year of this ongoing pandemic, and this is what was there. And same happened years back with HIV. People felt that HIV will be spreading through contact, through touching, while eating, while sharing towels, utensils, even when you are sleeping with infected individual. So there were so many similarities between, if you just think about it, and being in the profession and had been observing all these things in so many years, today with this ongoing pandemic, I won't say that I'm a privileged professional who is observing it. I would say it is disheartening to observe. But yes, whatever I had read during my during my college days about how things would happen, how societies will be impacted with such disease, is what is visible. So what I'm trying to make you all understand is, whether it is HIV, whether it is coronavirus, or whether it is any damn infection which is spreading, please, when you know that you have to get yourself tested, please get yourself tested. Don't wait. Even if slightest, thought is there in your mind that maybe I might be infected, even with coronavirus, I should first of all go and get myself tested. There is no harm in doing it. You know that if it is found to be positive, that is COVID positive, you have to quarantine yourself, you have to stay at home, and you have to live. But don't be in the denial mode, because what I had been seeing, even in HIV reactive cases, there are people who are in denial mode. They don't want to accept it. And what bleeds my heart is that in spite of such progressive health system, such progressive counselors in the field, and we all, educated people, still we have this little bit of fear of self-stigma and discrimination, which needs to be tackled. So I finish this discussion here with this little request: get yourself tested, get yourself vaccinated. If you haven't got yourself, be safe, wear mask, eat healthy food, don't panic, just be calm, cool, and support each other. Okay, so with this, signing off for the day. Take care, and I'll see you again next time. Maybe some other information related to HIV, or maybe the next lots of HIV. Yeah, take care. Bye bye. Namaste.